So a big part of the challenge in the new contract between the NHS and its patients is an educational one. It's helping people come up to speed with what they need to know in terms which they can understand and control about their own disease. And we're seeing this much more.
The future role of patients in the NHS, I think, is probably quite bright in that there's now a huge recognition that they should be more involved in shaping services.
The best healthcare systems are those that engage patients both during the time they're in hospital or in other setting where they're using the services, or retrospectively.
It's first and foremost about actually allowing patients the opportunity to engage, to speak, to talk. Sadly, because of how the NHS has historically engaged with patients, we've often disempowered patients and made them hesitant to talk to us, to help them get involved. Too long, the NHS has gone to patients and said, we're wanting to do this to that service. In reality, what we need to do is go back several steps to talk to patients around, well, for you, what are your priorities?
Slowly but surely, we are working with the professionals. And I think that's what it's about. It's about volunteers working with the professionals, but the professionals knowing that we're not trying to step on their toes. We're trying to cut that in-between time where a doctor has 10 minutes for an appointment with each patient, and the patient doesn't get everything out within that, or they're sat there wondering, what do we do? How can we do it? And they've forgotten everything that they need to speak to the doctor about. So why can't we have a volunteer health champion in the surgery with a sheet that's got some questions? Get the most out of your appointment. Use it, fill it in. It works.
We own our bodies, we own our minds, and if something is being done to you and with you, surely you're the person that should be at the heart of the thinking. And when you get people that come out of a consultation or have been speaking to a nurse and then they're trying to second guess, what were they talking about? What were they saying to me? That's really not good enough. So it is about tuning in, having user-friendly language that's easy to understand, good quality literature, but also things like telephone numbers and people to talk to if you're unsure or unclear.
A much more grown-up and useful and productive discussion is to go to the public and say, here is the resource that we currently have in this particular area. This is the amount of money we're spending on diabetes or renal medicine or cancer or mental health. We've got some ideas for how we might spend it better, but what do you think?
I think what's really interesting over the last 60 odd years since NHS came into existence is the issue of trust. Patients, when NIBEV informed the NHS, were very grateful for the fact there was a health service where previously there was none, and implicitly trusted doctors to do the right thing. What experience has shown over the last number of years with things like the Bristol Heart scandal, with mid-staffs, is actually some of that trust was possibly misplaced. And it wasn't necessarily always the case that care patients receive was always of the best standard. And what that's done is start to damage the trust that patients have in the NHS. That's really why patient empowerment's the key to this, because we need to rebuild that trust and re-establish it based on solid, credible facts.
I saw a fascinating interaction when I visited the hospice in Exeter. They have a relationship with the Peninsula Medical School, and this is what happened. A group of medical students, obviously pre-arranged, came to the hospice, and I was invited to sit in on this. And there was a circle of people who were suffering from cancer and were at the hospice, all of whom had terminal illnesses. And in an outer circle, the medical students and myself sat there, and the people, the patients, then talked through their experiences about what it was like to be told that they had cancer. And what we got out of that was the good experiences, how people talked about people that were very sensitive and very tuned into the needs of the individuals, and some that felt it was a little too blunt and a little too cold. And that is the kind of imaginative thinking that I really do think brings to life when you talk about the patient experience.
We recently felt that there was a need to resign out of our services But we were very much aware that was a need of a commissioner, and we had concerns about the manner in which it was delivered. We didn't know what the patient's perception was. So first and foremost, we actually started to talk to patients about, well, why are you going to out of hours? What do you feel about out of hours provision that's done locally? What do you feel are the problems facing out of hours? And equally, what do you see as other solutions to do that?
London went from an area where stroke care was patchy, with some of the best care in the country, but some of the worst care in the country, to what now is probably delivering the best stroke care of any capital city in the world. And we wouldn't have made those changes without profound patient involvement in the design.
I see the role of the more experienced patients who want to take that confidence and knowledge and basing on their experience to help inform the whole planning of the health system.